On our tech feature this morning, we continue to shine the spotlight on women that are doing phenomenally well in their respective fields. Thato Schermer and Dr. Nonhlanhla Sitole are the brains behind a new, unique innovation that aims to advance women's health in the country. This is through their Zoie Health platform, a digital women's health and wellness clinic created by women for women with a unique understanding of women's health issues. Thato and Nonhlanhla join us now this morning to tell us more about this project. Ladies, a very good morning to you. Thank you so much for joining us. Welcome to Morning Live.
Good morning, Simpiwe. Thank you so much for having us.
It's good having you both ladies on the show this morning. Thato, I'm going to start with you. Speak to us about how you and Nonhlanhla came together to create this digital women's health clinic.
Yeah, so my background is mostly in business and in strategy and in tech. And Dr. Noni is our smart scientist, and she's more on the clinical side. And I think with both of our unique experiences with women's health issues and problems that we knew that our families and our friends and all women face, we decided to solve this real problem that women are facing, which is poor access to adequate healthcare, caring healthcare, and holistic healthcare.
So how does this platform address those problems?
So what Zoie does is it makes healthcare affordable. So we're using a very tech-based approach to solving this solution. The first way we do that is that we enable people, women, to have telehealth consults with different providers based on whatever stage of their life they're in. So if you're a young woman who's, looking to talk about their contraceptive options, instead of paying for, a full GP consult or going to the clinic, a government clinic, and then waiting in line and, taking a lot of time to get information, we provide you with information. There's content. There's also a community where you can talk to people who are going through the same things that you're going through. And then the aspect of having telehealth means that you're really cutting down on the cost of time, of travel, and also just the expense, because it's obviously a telehealth consult. So having it virtually really does reduce the cost for you.
Okay. Noni, what would you say are some of the women's health issues that are not understood and you aim to correct them through this platform?
Definitely. So one of the things that we found in our research is that not only is healthcare not affordable, there's a stark difference between private and public healthcare.
Okay.
And some of those issues include lack of integration of healthcare. So, if you have, for example, you need a psychologist or you're having mental wellness issues, you need to find a GP to prescribe your medication for you. So it's fragmented in the sense that you don't have your healthcare providers talking to each other in a way that brings your healthcare integrated and holistic. So that's definitely one of the things we're trying to solve. And holistic also for us speaks to, taking care of the whole woman. So it's not just your physical health, your mental health, that all the different things that you face at different stages of a woman's life, whether you're pregnant, let's say you've just had a new baby. You don't only need help with your baby, but you need to think about, your physical body. You need to think about your mental health. You need to think about what you need to do when you start going back to work. So we have those types of different providers where, at different stages of a woman's life, all the type of medical professionals that you would need to engage with at different stages of your life.
Thato, for women that are watching this interview right now and would like to access these services that the Zoie app offers, how do they go about doing that?
Yeah, so it's as simple as, going to our website, www.zoiehealth.com, and that's ZOIE. And you can access all the services from there. We've also created a WhatsApp for business where, people can access and book services and get a hold of us via WhatsApp for those who maybe are a bit more data crunched. And we've made it quite easy. We also use social media as a channel. So if you find us on social media, you're actually quite easily able to book services and find help there too.
Well, we know that mental health, fertility and pre or post-birth support are just some of the many issues common in women's health care that you say are often neglected. Why is this, though?
So we believe that, most of the decisions or the larger part of the developments that take place in healthcare are not necessarily led by women. So I think when you're trying to solve an issue of women's healthcare, you need to understand what it is that women are struggling with. So I think that's what makes us a unique team, because we understand as women the things that we've been through, and also based on our research, speaking to women and actually asking them, what are the pain points that you have? and then building solutions that are able to assist them to solve those pain points in a way that works for them. So I think one of the big things that Zoe is doing is being data-driven. So we talk a lot to our members, even our providers, to find out, if you're a healthcare provider on the Zoe platform, how can we make this easier for you? How can we make it possible for you to reach more women? And then as a member, what is it that you need in your particular life event that would help you to navigate all the challenges that women face in healthcare issues?
Now, and Thato, how do you cater for those that are interested but have limited access to the internet and digital platforms?
Yeah, no, that's a fantastic question. And how we're trying to do that, I think in the early days, it's two ways. One, we've made social media a way that people can easily access information. So we produce a lot of content. We partner with various momfluencers, various health providers to give talks and to give people access to information so that they're getting it, exactly where they are, particularly in social media. In the future, we're actually working on a few integrations with the likes of, creating WhatsApp bots to help people. WhatsApp is a low-cost data platform, so people can access information, can get the help they need via WhatsApp instead of having to get, download an app or use a lot of data. And I think in the future, certainly we are investigating other options such as, SMSs, USSD, etc., so that we're much more accessible and not just focused on those who have. We know South Africa has a massive problem of inequality, and we know that we want to serve all women, right? All women in urban areas and in rural areas. Mm-hmm. And so we are building that into our pipeline, and hopefully I think today people are already getting quite a bit of care across the board.
Okay, Noni, just before we let you go, as we are currently celebrating Women's Month, what advice do you have for women out there regarding understanding their health issues?
I think the advice that I have is it's important to really take time as women to look after ourselves. I think as women, we tend to take a lot of time looking after our families, and we don't necessarily take time for ourselves. So I think it's important for a woman to, not only look after your physical health, but your mental health as well. And, it's a shame because when women don't look after themselves in terms of, doing their annual checkups, you get into a situation where, for example, cervical cancer is the second most common cancer in women in South Africa, and the cancer that most women die of, and it's actually preventable and treatable. So when we're not focusing on actually going for a pap smear maybe once every 3 years, things like that can be avoided, where you have women who are dying of cervical cancer, but there's ways which that can be prevented. So I think it's important for women to take care of their health, and also not just physical, but mental, because we tend to neglect that, even though, we make that a priority for the other people in our lives, like our kids and our partners and our parents and our elderly grandparents.
Noni and Thato, lovely chatting to you ladies. Thank you so much for joining us and for having come up with such a brilliant initiative that will be a catalyst for, women's health. Lovely chatting to you. Thank you so much for joining us.
Thanks. Thank you very much.
That was Thato Schermer and Dr. Nonhlanhla Sitole, and we've been talking to them about their new and unique digital women's health and wellness clinic called Zoie Health platform.